So that condition is knee joint effusion, which is most commonly this effusion is basically very apparent around the knee joint. So it is basically a pathological condition, but very common condition, and almost all the condition is associated with this. And for rule outing joint effusion, basically we observe the knee and it is confirmed by palpation. So what should be the grip for rule outing the joint effusion? First of all, we have to maintain a grip like this that should be just distal to the knee joint line. So this is the joint line. We can feel the joint space between the distal femur and proximal tibia plateau here and here also. So just make a grip like this. What is the advantage of this position? Basically in this extended knee position, all the three aspects, medial, lateral and posterior, these three aspects get tight and all the effusion basically comes in the front of the knee. And this grip basically prevent the spread of fluid distally to the knee. So make a firm grip like this, which is covering the medial and also the lateral aspect of the knee. Now the second step, we just have to stroke over the proximal to the knee joint like this, as we do in wiping the fluid. So this helps to bring the rest of the fluid which is dispersed around the knee or thigh, to keep it or to bring it around the knee joint. So after few stroke, we just again maintain another grip just proximal to the knee joint and then tap over the patella like this. This is our normal subject, so I am just demonstrating. So after milking or after stroke, we just maintain the grip and then stroke or tap over the patella. So in pathological condition, basically you will feel like whenever we put a wooden block in the water and you just tap over the wooden block, that will dip into the water, and after removal of the pressure it will again come over the surface. So you will feel like that, and this test is called the dancing patella test or patella tap test. Yes.